It's no surprise to anyone that smoking is a major health concern. It affects millions of people a year and is responsible for billions of dollars in increased healthcare costs. In this video, we'll explore the facts when it comes to smoking, how cigarettes can be a silent killer, and how smoking affects more than just the user's lungs. Most important, we'll show you how you can quit and how you can encourage others to do the same. Smoking is an addiction. Cigarettes contain nicotine, an addictive drug that makes it nearly impossible for users to quit.
I've worked with people quitting who will tell me with a straight face, "Doc, my car won't start unless I have a cigarette in my mouth." But at the same time, even when they're going through those habitual things, nicotine is getting into their system very quickly when they're inhaling on a cigarette. And that works on areas of the brain that have big effects on people's mood, on their concentration. Does a lot of things that, at least in the short term, can be pretty desirable for folks.
It's a habit that is killing countless individuals. More than 438,000 people are killed each year from smoking-related illnesses. That's 1 out of every 5 deaths in the United States. More than the deaths caused by HIV, illegal drug use, alcohol use, car crashes, suicides, and murders combined. According to the American Cancer Society, smoking causes about 90% of lung cancer deaths in women and 80% of lung cancer deaths in men. It causes cancer of the bladder, mouth, throat, kidney, and stomach. Smoking causes coronary heart disease, the leading cause of death in the United States. Smoking almost doubles a person's risk for stroke. As a smoker, it's 10 times more likely that you'll die from lung and respiratory disease. And users aren't just hurting themselves. They're hurting those around them too, because of secondhand smoke. From newborns to 18 months of age, secondhand smoke is associated with as many as 300,000 cases of bronchitis and pneumonia each year. Secondhand smoke from a parent's cigarette increases a child's chances for middle ear problems, causing increased coughing and wheezing. If both parents smoke, a teenager is more than twice as likely to smoke than a teen whose parents don't smoke. Pregnant women who smoke are more likely to deliver babies with low birth weights. Smoking accounts for nearly 4,000 newborn deaths each year. Aside from health problems, smoking has a huge effect on healthcare costs. Smoking generates more than $167 billion in health-related costs each year, including the cost of lost productivity due to smoking. While these statistics seem daunting, there is hope for smokers who want to quit.
Really, the best way for people to quit is to use a combination of some counseling and support along with medicine to help with the craving and withdrawals.
First, it's important to discuss any plans to quit with your doctor. They will know the best option for you, and there are many options available. The most widely used option to help smokers kick the habit is by NRT, or nicotine replacement therapy. This method uses other means, like gum, lozenges, inhalers, nasal spray, or a patch, to deliver a controlled amount of nicotine to your body. This helps smokers treat the sometimes difficult withdrawal symptoms and cravings. It's important to know that nicotine replacement therapy only deals with the physical aspect of addiction, and you should always pair NRT with a program to help the psychological aspects. See your doctor for program options that are right for you. There are also medications that can help smokers quit for good. Drugs like Zyban and Chantix reduce or eliminate the symptoms of nicotine withdrawal and lessen the pleasurable effect a person gets from smoking. Many organizations have also set up telephone quit lines for quick access to help and counseling for those who want to quit smoking. Call 1-800-QUIT-NOW for a phone counseling service in your area. We'll give you this number again at the end of the video. So you finally made the decision to stop smoking. Here's some guidance to help you along the way. First, pick the date and mark it in your calendar. Tell your friends and family about your quit day so they can offer support. Get rid of all the cigarettes and ashtrays in your home, work, and car. Decide on a plan. Will you use nicotine replacement therapy or medications? Talk to your doctor for help with this. Once you stop smoking, it will be easy to start again. Don't set yourself up for failure. Instead, think about the following. Avoid people and places where you are tempted to smoke. Change your habits. Smoking is habit forming. Do you find yourself always lighting up after a meal? As soon as you wake up? When you're driving in your car? Or when you're drinking with friends? Break the habit. Drink juice or water instead of alcohol or coffee. Drive different routes to work. Sit at a different spot at the dinner table. This will keep your mind off smoking and on something else. Consider alternatives. Use candy, gum, or other foods to keep your mouth occupied. Do something to reduce your stress. Exercise or new hobbies will keep your hands busy and are great ways to deal with stress. Consider deep breathing. When you were smoking, you breathed deeply. When you get the urge to pick up a cigarette, take a deep breath of clean, fresh air. And delay your urges. When you feel that you're going to light up, tell yourself you must wait 10 minutes. Oftentimes, this will help the strong urge go away. Quitting smoking isn't an easy task. In fact, you might not be able to do it on the first try. But don't give up and constantly think about the health benefits of you and your loved ones when the smoke finally disappears. For help with quitting smoking or to find a telephone counseling center near you, call your local Quit line at 1-800-QUIT-NOW.